to East Texas Live on KETK. Well, joining me now is Vicky from ETMC, and today she's going to share a little bit about heat-related illnesses. Welcome, Vicky.
Hello.
Okay, so you guys are probably getting a lot of calls this time of year.
Well, we get quite a few from people that get overheated.
Yeah, so what all do you see then, really?
I mean, it's anywhere from they start feeling dizzy, at the very mild symptoms, very extreme. You have someone that goes into heat stroke that could start having seizures from being too hot, go unconscious, get confused.
Yeah, because there's heat stroke and there's heat exhaustion. So kind of tell us the difference between the two.
So on the mild side, you go outside, you start getting a little hot. Maybe you're not drinking enough water. Maybe you've just been outside and not realized that you're getting to get too hot. So you get dizzy. You might get a rash. You start sweating quite a bit. At that point, you need to go inside, cool off, get in the shade, take a break. Make sure you drink plenty of fluids and not just water. If you're sweating a lot, maybe throw in some sports drinks, alternate it with the water. And then as it gets worse, as you stay outside, you get even more confused, dizzy, nauseated. And if you get too hot, you could end up having a seizure because just your body is overheated so much.
I was going to say, how often is dehydration an issue? Because really, I feel like the most important thing is to stay hydrated during the summer.
It's always been an issue. We don't gauge very well. By the time you get thirsty, you're already dehydrated.
Okay.
So it's a good idea if you plan on being outside, if you're planning on working in the heat, to just steadily drink fluid, and if you're sweating too much, if you're out there for more than an hour, throw in the sports drinks at that time.
Well, often is nausea a symptom then of anything?
Yes.
Okay.
So once you start getting into that extreme heat exhaustion and into the heat stroke, so in the heat exhaustion you might start getting nauseated. When it gets to be a bit more, you might start to vomit even.
Well, and I always wonder, we talk about the heat rash, is there a point where you've ever come into contact with someone who's started to blister, where they've been outside or in the heat too long?
That's more, the blistering is like a second-degree burn.
Okay.
The heat rash is just like a regular rash. When you start seeing blisters, that's a second-degree burn. That person's been exposed to the sun for way too long, or they've gotten burned by something.
So again, let's just hit on those really important preventative tips then for people to keep in mind.
So just stay hydrated. If you plan on being outside for a long period of time, kind of get accustomed to the heat, start early, so you're not just out there in the heat. The elderly and the very young are more susceptible to getting overheated. If you have a medical condition, if you take medications, talk to your physician, because some of those things can get you more, you get overheated easier.
Okay, sounds good. Thank you so much, Vicky. Appreciate it. All right, up next, like we just said,